What do you guys got? Possible overdose. There's some stuff sitting on the table there. Can you wake up for me?
Last year, we lost over 64,000 people in America. That's more fatalities than the average number of servicemen lost during World War II. So if somebody does not want to call this a war, I don't know where you get 64,000 Americans dying from heroin and opioid overdoses. Not ever be a problem.
Over 2 decades ago, painkillers derived from synthetic morphine were seen as a miracle drug for patients coping with chronic pain. Since then, numerous forms of synthesized narcotics have made their way into doctors' offices and pharmacies. According to the Centers for Disease Control, as the number of opioids increased, so did addiction rates. The Trump administration has declared the problem a public health emergency. A CDC study released this month reports a 70% increase in opioid overdoses in the Midwest from July of 2016 to September of 2017. For those fighting opioid misuse on the rural front, resources can be scarce. At the USDA, officials are using more than $2 billion in grant and loan programs to help small towns enhance their abilities when responding to the opioid epidemic. In 2015, the CDC reported over 33,000 deaths nationwide related to opioid overdose. Over the past 2 years, that number has more than doubled.
As rural leaders, it is important to understand the nature of this issue, the impact that it is having on small towns across our country, from Michigan to Montana, and the role that we can play as leaders in the solution at that grassroots community level.
Wake up for me, dear.
Those developing the strategies to fight opioid misuse are fighting a war on 2 fronts. One is availability. Officials with the Iowa Governor's Office of Drug Control Policy are concerned medicines like Percocet, Oxycontin, and other fentanyls have a safer persona than illicit drugs. Komendowski believes that safer persona creates a climate for addiction. The other front is the amount. Federal government officials contend, with a perception of low risk, opioids have been prescribed in ample amounts with little concern for misuse. Making physicians aware of how many pills are being written into prescriptions is one way opioid misuse is being confronted.
Previously, you'd see a prescription come in maybe for 60 tablets. Now we're seeing more prescriptions written for 30.
As a licensed pharmacist,
Bring that with you, though. Okay.
And legislator in the Iowa House of Representatives, John Forbes uses his unique position to help craft legislation aimed at helping curb opioid misuse in rural Iowa. But Forbes knows he and his colleagues on the other side of the pharmacy counter are on the front lines of fighting the epidemic.
Pharmacists just need to be vigilant whenever they have a prescription presented to them that they have questions about.
A tool pharmacists use when a suspicious prescription comes to their attention is the Prescription Drug Monitoring Program. Established in the 1930s to track Schedule II narcotics, the program has evolved to an electronic database stretching coast to coast.
We check that database on new prescriptions, especially patients that are new to our pharmacy, to make sure they're not doctor shopping or going to multiple pharmacies to try to obtain controlled substances.
Last year, the Drug Enforcement Administration stepped in to help slow the opioid epidemic by allowing pharmacies to partially fill prescriptions.
A program like this helps keep larger quantities of opioids out of the system, so there's less chance for diversion.
Officials see a long fight ahead that will require a balance between limited funding and scarce resources.
And when the consequences hit American culture anywhere, low population, rural areas where the density is low, they have the least amount of health care, the least amount of counseling, the least amount of resources for public safety, they're at risk for much longer than where we can apply all the big money and resources.
For Market to Market, I'm John Torpy.